So we're actually going to start our journey today, not with any posters, but this beautiful piece of artwork that I had commissioned for the clinic. The artist in question was Surita Mehmi. There is her card, but we worked together and she created me this beautiful piece that is going to go into the clinic, and particularly like the colour scheme that we used together, very much like the blues and greens, and she added a little bit of flair with the yellows there. You can see the ocular structures. We have the lower lid and the lashes. We have a higher quantity of lashes on the upper lid there. They spring out beautifully. Have your sclera here and some intricate blood vessels there, and some on this side. But my most favourite structure on this piece is the iris and the detail that has gone into creating this particular structure. So you have a beautiful dark pupil. I love the double tone of the pupil margin there. A sort of electric blue, becoming a slight aqua colour there. As you can see, we may have some little iris freckles there, if you want to refer to them as that, and maybe some iris collarettes there, maybe some little crypts. So that is the beautiful piece by Surita. Okay, so this area of the clinic I've located two grading scales for you. I'm going to start with this one on the right. We have the LOX 3 grading scale here for lens opacities classification system. So here we are essentially grading different types of age-related cataract. The top row you have your nuclear type, and we've essentially done a cross section of the crystalline lens to better visualize this type of cataract. This is your hazy type opacity. As you can see, we get progressively worse, going from left to right, and you can see how within the crystalline lens it's becoming gradually more hazy. So that's your nuclear type cataract. The second row, this is our cortical type. Now some people liken this to spokes, like on a bicycle wheel. People use that analogy to describe a cortical type cataract, where the opacities tend to come from the peripheral edges of the crystalline lens, progressively worse, and at this point the cortical cataract is completely encroaching on the patient's vision, so you'd expect some symptoms in this situation for sure. This one is maybe just encroaching if we say the pupils in the centre. And then moving on, we have our posterior subcapsular type of cataract. As you can see, it starts here, on the posterior surface of the crystalline lens, and it gradually, over time, increases in size to the point where the patient is going to be visually affected. So that's the LOX 3 cataract grading scale. Very useful before referring patients for cataract to note what type and severity. Now, patients aren't limited to just developing one type of these. They can experience a combination of, say, nuclear, the cortical cataract, for example. Okay, moving along to this Bosch and Lomb grading scale for certain ocular features. Artist is Nathan Efron. We essentially have 5 categories going from 0 to 4. Normal to severe, so progressively worse. And we're grading things such as conjunctival redness, limbal redness. The limbal vessels are these that are adjacent and just crossing onto the cornea there. Those are the limbal vessels. And we have quite a serious condition here, corneal neovascularization. Essentially get new vessels growing into the cornea, which can encroach the patient's vision. And it may occur due to corneal hypoxia, epithelial microcysts there, corneal swelling, corneal edema there. You can see changes within the structure of the cornea, have a loss of transparency there. If someone's damaged their cornea, something's gone in it, they've scratched it, rubbed the eye, we can check for corneal staining by incorporating some ocular dye. We can also visualise conjunctival staining, these sort of little ripples which are normal. This is quite a severe case of conjunctival staining. Could, for example, be due to a poorly fitting soft contact lens. And then finally, papillary conjunctivitis. Now, this could be a thing if someone is experiencing an allergic reaction, allergic conjunctivitis, for example. We get these little follicles forming potentially due to white blood cells flooding to this site in order to try and deal with the antigens. This is very severe there. So that's those 2 posters. Okay, so we're going to be looking at this poster of the skeletal system. Now essentially we have 3 views of the human skeleton. Your anterior view, your lateral view from the left side, and we have the posterior view here. So we're not going to label every single bone, but we're just going to look at some key bones and maybe introduce some that you may not be familiar with. So just looking here, you can see how the skull is formed of various plates. For example, we have the frontal bone here, the parietal bone there. Okay, you have your orbital sockets there and there, the nasal bone, and below the orbit we have the zygomatic bone there. I'm sure you all know the mandible, the jawbone there. You can see the rows of teeth, upper and lower, and the nasal bone there. Okay, the skull is attached to the spine there. There is the posterior view of the spine. It carries the spinal cord, nervous tissue, connects with the brain for processing. And you have this cage here, which are your ribs. I believe you have 12 pairs of ribs there. Better seen from the lateral perspective there. And you can see the bottom two ribs actually don't form part of the cage. They just float there. So that's the bottom pair of ribs. Okay, we have this clavicle bone here attached to the breastbone there, the sternum. And there for your shoulder, your greater tubercle, right, the rather long humerus bone there, right and left, and from the posterior part there. You have a trochlea there, and then you have your two wrist bones, the radius and the ulna. Okay. And then we come to the bones of the hands there, which you can actually see better down here, where we have two blown up images of the hand. We have the dorsal view and the palmar view there. And you can see the very fine bones there. You can see the carpals coming to the metacarpals there, and then the phalanges there. Okay, 1, 2, 3 parts there. All right. And we have the pelvis here. We have a ball and socket joint there. And this is your very long femur bone, your thigh bone, left and right. We come to the knee next. We have the patella. And then we come to the two bones in the shin. Okay, we have the tibia and the fibula there. Okay. And coming to the foot, we're going to divert our attention down here, where, like the bones of the hands, we have two enlarged images there. Again, dorsal view and the plantar view there. So you can see the very fine structures and lots of intricacies there with quite complex names. Don't worry too much about that. So, and then just here, the lateral view and the posterior view are your wing bones there. That is your left scapula and your right scapula. Okay. Just directing our attention over here, we have some tiny little bones here. These are not to scale. These are the ossicles, and you will find these small bones within the ear. And then looking at the femur bone, but in more detail, we have a blown up image there. You can actually see the vascular network within the femur and the bone marrow there. So that's the skeletal system. Let's move on to the next poster. Okay, so earlier when we were looking at the skeletal system poster, we did discuss the small bones found in the ear, and this is where I'm going to start the journey on this poster. We have the ossicles of the ear. 3 bones there, which tend to vibrate and give us our auditory signals and waves. We have the malleus, we have the incus, and we have the stapes there. Kind of looks like a stirrup. And the bones are located within the middle ear portion. Okay. Here is the ear canal. We have the medial section and the lateral portion there. And as you know, moving through the canal, we reach the tympanic membrane there. In other words, the eardrum. And we have various structures to the tympanic membrane, such as the pars flaccida, the umbo of tympanic membrane there, just to name a few. So there is the external ear. Some of the structures have been labelled. The helix, we have the triangular fossa there. There is the antihelix, the concha, and the lobule there. Okay, and within the internal ear we have the vibrations and sound travelling. This is a blown up portion of the internal ear. So we have the cochlea there. And notice how we have 2 nerves. We have the vestibular nerve and the cochlear nerve there. And then we have the portion of the brain denoted here, which is associated with processing our auditory stimuli. This is the auditory cortex, areas 41 and 42, known as Wernicke's area there. And looking at the cochlea, I believe here, registration of the different frequencies in the corresponding sections of the concha. That's a little bit about what's capturing what in terms of frequency of sound. And then we have the position of the internal ear in the skull there. So ears isn't my forte, but I just wanted to go through a few of the structures there.